Hi everyone, welcome back to Palliative Myths. Tonight, we'll be taking a look at 5 more myths related to palliative and end-of-life care. We're once again joined by our panel of prestigious judges. A leading doctor, a renowned nurse, a distinguished social worker, and a famous researcher. Let's get started. Bring out our first myth. Palliative care is only for the elderly. I know we're just getting started, but do you judges mind if I try this one?
Go for it.
Well, it seems to me that life-threatening and life-limiting illnesses occur across all age groups. Although more common in older people, younger people also develop progressive and curable illnesses.
Correct. You got it. Palliative care is applicable for all ages.
Thanks for letting me jump in there. Bring out the next myth. Palliative care is just for patients with cancer.
Palliative care is applicable for many different diseases, not only cancer. This includes advanced heart, lung, kidney, and neurological diseases such as dementia and ALS, amongst others.
Palliative care is for all life-limiting illnesses, cancer or non-cancer. Our next myth, palliative care is done only by palliative care specialist teams.
All health professionals who care for someone with a life-threatening and life-limiting illness should know the essentials of good palliative care. Family doctors, nurses, oncologists, cardiologists, pharmacists should all have training. We cannot rely only on a small number of palliative care specialists to provide palliative care.
Palliative care is the responsibility of all health professionals who, in the course of their work, provide care to patients with life-threatening and life-limiting illnesses. Next, everyone has access to good palliative care.
That's definitely untrue. Only 16 to 30% of Canadians have access to palliative care, and most of them only receive palliative services within the last days and weeks of life.
Work still needs to be done by health services across the country to fully integrate palliative care and ensure access to palliative care. And now our final myth of the night, and it's a doozy. People are immortal.
Everyone dies someday, and today sudden death is much less common than it once was.
The World Health Organization states that in Canada, chronic diseases are projected to account for 89% of all deaths.
That one is definitely busted. No one is immortal. That concludes tonight's Palliative Myths. Thanks to our judges, audience, and those of you who tuned in from home. Be sure to keep an eye out for upcoming videos from Pallium Canada at www.pallium.ca. Good night, everybody.